Picture this. It's the middle of July, it's 95 degrees, and a lab named Cooper is having the best day of his life at the neighborhood pond. He takes one lap of water. One. He's dead before dinner. That's not a scare story I made up for a slide. That's a case that walks into ERs every single summer. So today we're talking blue-green algae, and by the end, you'll know exactly what to look for and what to do. Quick correction to your vocabulary, by the way. Blue-green algae isn't actually algae. It's cyanobacteria, and it doesn't hurt animals by infecting them, it hurts them with the toxins it makes. That distinction matters because it tells you the whole disease is about dose and exposure, not about killing a bug. Let's start with the clinical sides. There are basically three flavors of trouble. Neurotoxins, antitoxin A, and saxitoxin, those are the fast ones. Seizures, muscle tremors, respiratory paralysis. Minutes. Antitoxin A got nicknamed very fast death factor, and honestly, that's the whole lecture in 3 words. Hepatotoxins are the slower burn. Microcystin goes straight for the liver. You get vomiting, bloody diarrhea, jaundice, and liver failure over hours. That patient might look survivable at hour 1 and be crashing at hour 6. So don't let a stable-looking dog fool you. Dermatotoxins are the mildest of the three. Rash and irritation where the water touched skin. And this I want you to remember. Some of these patients die peracutely with no warning signs at all. Owner says the dog was swimming and then just collapsed. That's the presentation. Exposure routes. Number 1 is drinking the water, but they also absorb it through skin, inhale spray while swimming, and this is the one folks often forget, they groom the algae off their own coat afterward. So a dog that never took a sip can still get a full dose 2 hours later on your exam table. What does a bloom look like? Think pea soup green, blue-green, or a red-brown scum sitting on the surface. Classic description, like somebody dumped paint on the pond. And this isn't just a dog problem. Cats, cattle, horses, birds, wildlife, and humans are all on that list. So when you take that history, ask who else went into the water. Diagnosis. I'm going to be straight with you. This is a clinical diagnosis, history plus exposure. There is no in-clinic test that confirms it while your patient is crashing. So the most valuable diagnostic tool you own here is a good question. Did this dog have access to a pond, lake, or slow-moving water in the last 24 hours? That said, collect a water sample if you can and get it to your state lab for toxin analysis. Run your chemistry, ALT, AST, and bilirubin climb in hepatotoxin cases. And reference labs can run ELISA for microcystins. Just know that all of that confirms your suspicion after the fact. It does not drive your first hour. Treatment. Here's the hard part. There is no antidote. None. Everything you do is aggressive supportive care. Fluids, seizure control, airway, liver support. If there's skin exposure, bathe that dog immediately with gloves on because you do not want it on your hands either. If ingestion was under 30 minutes ago and the patient has 0 neuro signs, you can induce emesis. If there's seizing or tremoring, absolutely not. You'll just add aspiration to their problems. Activated charcoal is reasonable for microcystin. And then the line that actually saves lives. Prevention is the treatment. No access to bloom-covered water, ever. If it looks like pea soup, it's a no-go. Last thing, and this is why this matters more every year. Warmer water plus fertilizer and nutrient runoff equals more blooms, lasting longer in more places. Harmful algal blooms have now been reported in all 50 states. Peak season is July through September. which is exactly when your clients are taking their dogs to the lake. So your takeaway is this: summer, water access, sudden collapse, or acute liver failure. Put cyanobacteria on your list immediately, treat aggressively, and don't wait for confirmation. And when you're doing your wellness visits this summer, tell every single dog owner, if the water looks green and gross, keep the dog out. That one sentence from you might be the whole treatment. If this helped, like, subscribe, and share for more.